Oh babe, humingi ka na. Hindi mo ba alam na pwede kang mag-infection dyan sa kiki mo? Bakit naman? Madumi ba yung batuta mo? Hindi, oo, pero hindi sa ganung paraan. O sige nga, Doc, enlighten me. Kasi ganito yan. Pag malapit na kami labasan, merong pre-cam. At ang ginagawa ng pre-cam ay, tiyatanggal yung mga dumi sa loob ng tract. Ibig sabihin, yung daluyan namin, sumasama na doon yung mga dating ihi, yung mga patay na sperm, at yung mga mikrobyo. At ang nangyayari doon ay, pag sumama yun, sabihin na natin para siyang flush. Pwede kang maapektuhan. Ay, ganun ba? Ano pa ba yung mga nakaka-infect na yan? Bukod sa STD, isa dyan ang UTI. Ano nga ba ang UTI? Or in English, what the is UTI?
What is urinary tract infection or UTI? A urinary tract infection, UTI, is an infection in any part of your urinary system, your kidneys, ureters, bladder and urethra. Most infections involve the lower urinary tract, the bladder and the urethra. Women are at greater risk of developing a UTI than are men. Infection limited to your bladder can be painful and annoying. However, serious consequences can occur if a UTI spreads to your kidneys. Doctors typically treat urinary tract infections with antibiotics. But you can take steps to reduce your chances of getting a UTI in the first place. Let's start with the symptoms. Urinary tract infections don't always cause signs and symptoms, but when they do, they may include a strong, persistent urge to urinate, a burning sensation when urinating, passing frequent, small amounts of urine, urine that appears cloudy, urine that appears red, bright pink or cola-colored, a sign of blood in the urine, strong-smelling urine, pelvic pain, in women, especially in the center of the pelvis and around the area of the pubic bone. Types of urinary tract infection. Each type of UTI may result in more specific signs and symptoms, depending on which part of your urinary tract is infected. For kidney, also known as acute pyelonephritis, you may experience back pain or side pain, high fever, shaking and chills, nausea and vomiting. Bladder, also known as cystitis, you may experience pelvic pressure, lower abdomen discomfort, frequent and painful urination, blood in urine. For urethra, also known as urethritis, you may experience burning with urination and discharges. So what causes UTI? Urinary tract infections typically occur when bacteria enter the urinary tract through the urethra and begin to multiply in the bladder. Although the urinary system is designed to keep out such microscopic invaders, these defenses sometimes fail. When that happens, bacteria may take hold and grow into a full-blown infection in the urinary tract. The most common UTIs occur mainly in women and affect the bladder and urethra. 1. Infection of the bladder or cystitis. This type of UTI is usually caused by E. coli, a type of bacteria commonly found in the gastrointestinal tract or GI tract. However, sometimes other bacteria are responsible. Also, sexual intercourse may lead to cystitis, but you don't have to be sexually active to develop it. All women are at risk of cystitis because of their anatomy, specifically, the short distance from the urethra to the anus and the urethral opening to the bladder. Infection of the urethra, urethritis. This type of UTI can occur when GI bacteria spread from the anus to the urethra. Also, because the female urethra is close to the vagina, sexually transmitted infections, such as herpes, gonorrhea, chlamydia and mycoplasma, can cause urethritis. Now, with the risk factors of the urinary tract infections, they are common in women, and many women experience more than one infection during their lifetimes. Risk factors specific to women for UTIs include female anatomy. A woman has a shorter urethra than a man does, which shortens the distance that bacteria must travel to reach the bladder. Another is sexual activity. Sexually active women tend to have more UTIs than do women who aren't sexually active. Having a new sexual partner also increases your risk. Next, there are certain types of birth control. Women who use diaphragms for birth control may be at higher risk, as well as women who use spermicidal agents. Next is menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract that make you more vulnerable to infection. Other risk factors for UTIs include urinary tract abnormalities. Babies born with urinary tract abnormalities that don't allow urine to leave the body normally or cause urine to back up in the urethra have an increased risk of UTIs. Another one is blockages in the urinary tract. Kidney stones or an enlarged prostate can trap urine in the bladder and increase the risk of UTIs. Suppressed immune system. Diabetes and other diseases that impair the immune system, the body's defense against germs, can increase the risk of UTIs. Another is catheter use. People who can't urinate on their own and use a tube, catheter, to urinate have an increased risk of UTIs. This may include people who are hospitalized, people with neurological problems that make it difficult to control their ability to urinate, and people who are paralyzed. A recent urinary procedure, urinary surgery, or an exam of your urinary tract that involves medical instruments can both increase your risk of developing a urinary tract infection. Let's begin with complications. When treated promptly and properly, lower urinary tract infections rarely lead to complications. But left untreated, a urinary tract infection can have serious consequences. Complications of a UTI may include 1. Recurrent infections, especially in women who experience 2 or more UTIs in a 6-month period or 4 or more within a year. 2. Permanent kidney damage from an acute or chronic kidney infection, or also known as pyelonephritis, due to an untreated UTI. 3. Increased risk in pregnant women of delivering low birth weight or premature infants. 4. Urethral narrowing or stricture in men from recurrent urethritis, previously seen with gonococcal urethritis. 5. Sepsis, a potentially life-threatening complication of an infection, especially if the infection works its way up your urinary tract to your kidneys. Now, with prevention, you can take these steps to reduce your risk of urinary tract infections. 1. Drink plenty of liquids. No, not that you need water. Drinking water helps dilute your urine and ensures that you'll urinate more frequently, allowing bacteria to be flushed from your urinary tract before an infection can begin. 2. Drink cranberry juice. Although studies are not conclusive that cranberry juice prevents UTIs, it is likely not harmful. 3. Wipe from front to back. Doing so after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the vagina and urethra. 4. Empty your bladder soon after intercourse. 5. Drink a full glass of water to help flush bacteria. 6. Avoid potentially irritating feminine products. 7. Using deodorant sprays or other feminine products, such as douches and powders, in the genital area can irritate the urethra. 8. Change your birth control method. 9. Diaphragms, or unlubricated or spermicide-treated condoms, can all contribute to bacterial growth.
Oh, if you like the video, please subscribe and like and comment, syempre. Iba-iba ang ating ano dun. Anyways, thank you for my sponsors. Pope, Tide. Anyways, okay, just kidding aside. So, thank you for Christine Damoking for letting me know which application to use, the slideshow. You can use it. Actually, it's in the description below. Special thanks to my cameraman, CJ Ferreras. Very nice cameraman. And special thanks also to Julian Gonzalez. He's from LaSalle and he's a med tech student who helped me do this work. Thank you.